Hi, everyone. My name is Jessie Wilburn, and today I'm going to be talking about my capstone project and experience, which was focused on improving independence for people with cervical spinal cord injury using functional electrical stimulation. So a little bit of background on my systematic review. So people with cervical spinal cord injury experience difficulties performing basic activities of daily living due to the decreased arm and hand function that occur as a result of their injury. And they consistently rate restoring arm and hand function as their #1 rehabilitation priority. So the purpose of this systematic review was to assess the evidence for functional electrical stimulation, also called FES, on upper extremity function and motor outcomes in people with cervical spinal cord injury. So this is my Prisma. I started with 200 studies that were imported for screening from both PubMed and CINAHL. And then after removing duplicates and going through the inclusion and exclusion criteria, I ended up with 8 studies that were included for final analysis. And of these 8 studies, 7 of them reported improvements in motor function as a result of either FES alone or FES in combination with conventional therapy. Overall, the articles were rated as low quality of evidence just due to some concerns for bias due to high levels of dropout, small sample sizes, and some differences in populations across studies. But overall, the results suggest that FES leads to improvements in muscle strength, muscle size, and hand function. But further high quality studies are needed to continue to assess this intervention. So my capstone experience was at Metro Health Rehabilitation, specifically in their research department, and they are a part of the Greater Cleveland FES Center. You can see the other partners listed here. So they are a research-based setting with a focus on developing technological solutions that improve the quality of life for people with neuromuscular impairments using FES. And specific to what I was looking at in my capstone project and my systematic review, they currently have research trials in place on the use of implanted neuroprosthetic devices, which are implanted FES devices, to restore hand function in people with cervical spinal cord injury. So for my capstone project, I completed a modified case report to investigate the effectiveness of an implanted FES device on hand function and independence in someone with a cervical spinal cord injury. So my case study participant was a 58-year-old woman with C5 through C7 complete spinal cord injury. The outcome measures included the grasp and release test, which is a measure of hand function and object manipulation, pinch force, specifically lateral pinch strength, and a qualitative interview. And then I compared the key ingredients in the study protocol on site for implanted devices to the key ingredients pulled from my systematic review for surface electrical stimulation. So these are the quantitative results. You can see pretty notable improvements in both of these measures. So with the neuroprosthesis turned on, there was an increase in pinch strength from 1.5 to 8 pounds. And then the GRT results improved from 1 successful completion across all objects with the neuroprosthesis turned off. So just using her natural function, since she has active wrist extension, she has a bit of a tenodesis grasp naturally. To 23 successful completions with the neuroprosthesis turned on. And these are some quotes that I pulled from the subjective interview that we conducted. So I think this helped to really highlight all of the ways that she's been able to increase her independence and quality of life over the past almost 30 years being a user of a neuroprosthesis. So you can see that she talks about being able to hold her dog's leash and the specific things at work over the years that she's been able to be more independent with. So overall, she described this as really worthwhile intervention to increase her quality of life. So this case study shows the long-term positive impact of a neuroprosthesis for someone with a C5 through C7 spinal cord injury. And the systematic review concluded that surface electrical stimulation can preserve muscle structure for future treatment options, whether that's tendon transfers, nerve transfers, or something like this, an implanted FES device. So therefore, implanted functional electrical stimulation systems can kind of pick up where surface stimulation leaves off to provide a more permanent functional solution compared to the shorter-term benefits of surface e-stim. And this is a list of some of the cool projects and activities I got to observe and help with while I was on site. I did want to quickly explain these pictures because I think it helps kind of bring my case study together to be able to see these visuals. So this here is a schematic of my case study participant. So in her right arm here, this was the device known as the freehand system, and it was the focus of the case study. So this is the device that she's had implanted for almost 30 years now. She also has a trunk system, which she mostly uses for regulating her blood pressure. So if she turns it on, it can help raise her blood pressure so that she doesn't pass out. And then in her left arm here is what's known as an NNP, so a networked neuroprosthesis. And this is a newer version of what she has in her right arm. So it has a greater number of electrodes and muscles that it can be implanted into. So the reason that I wasn't able to use this for the focus of my case study is because they were revising it during my experience, and it was just towards the end that they started doing some functional programming with this device. But those are all the devices that she has, and then these are the actual electrodes and power module that gets implanted into the body. And in this picture here is my case study participant. This is her left hand. So this is the newer device that I was talking about. And this was when we were just starting to mess around with some of the items in the grasp and release test to kind of do some functional things. You can see this is kind of a weighted cylinder that she's able to hold independently. And she said that this was the first time that she has held anything in her left hand since her injury over 30 years ago. So that was a really cool moment to be there for. And then here are some of my references. And this is the link to the FES Center. If you just search Cleveland FES Center, it'll come up. If anyone is interested in seeing some of the really cool, groundbreaking research that they have going on site, I highly recommend checking it out. And that is it. Thank you all for listening.